I was interested in upper management, and that's kind of where the DON position caught my eye with Newhaven. A friend had actually sent me the process, but I was familiar with Newhaven in Magnolia with their mental health clinic there, because they would do consults with our patients in the ICU. So that's kind of how I heard about Newhaven, and then heard about this position, was just through a friend online, and decided to apply, and they picked me. So
Is it going good so far? Are you enjoying it?
it's going great. Everybody's really nice, and I feel very welcomed and very excited to make this program work for everybody, and work as a team and be successful. It gives me a sense of hope for people that you don't always see a sense of hope for. I think in nursing, especially in intensive care, you're around a lot of death and dying and critical situations, whereas here I get to see kind of a different side of things, to where hopefully I'm saving a life in a different way. Instead of like doing chest compressions to try and start someone's heart back, here I get to try and help someone realize the mistakes that are going on, what has happened, and how can we move from those and save someone's life and quality of life for the rest of their life, and their relationships and their entire being. So it's saving a life in a different way that's not just medical, but on a different scale. I have a big family history of substance abuse, including my mother, who passed away in December due to meth abuse and a cardiac event. So I think it's important for people to understand that it's not just temporary things that are going to happen to them whenever they have a substance abuse problem, but there's going to be chronic conditions and long-term issues that are going to occur if you continue to do that. So I think educating people in that part of substance abuse would be a big help, to maybe understand the consequences of it's not just today and not just now and not just a problem now, it's a problem long term as well. Opioid epidemic is huge, you know. So especially prescription pain medication is a massive problem for people to get hooked on. People tend to think those are safe and they're prescribed, they're legal, it's all okay, but they don't even realize that they have a problem by the time it hits them. So I think that a lot of people consider maybe substance abuse as a problem for poor people or homeless people or things like that, but it's a problem across the board. Anybody could have an issue with substance abuse. We can work as a team, that the clients are getting not just mental health care, but medical care as well, through our nurse practitioner and things like that, and making sure that they fully understand the process they're about to go through, especially if they have to detox, and the nurses need to be there to watch for those signs of withdrawal and make sure that they can do that in a medically managed way that's much more comfortable.